Welcome back, dear viewers, to the YouTube channel Doctor's Wisdom Share. I always look forward to seeing you again and sharing medical stories with you, and today's topic is diabetes. Yes, many people hold a belief that I would call shallow, though I'm not sure if that word is entirely fair. They feel diabetes is a disease of the rich, that only middle-aged or elderly people get it, and that diabetes is still very far away from them. In the past, I often heard the saying, turn a corner, and you meet a hero, but I think nowadays the more accurate saying should be turn a corner, and you meet diabetes. Because according to the statistics I've read, out of every 15 people to have diabetes, and out of every 10 people to have prediabetes. In Greek mythology, Zeus gave Pandora a secret box and warned her strictly not to open it. But out of curiosity, she opened it sadly. What poured out were misfortunes filling the world, wars, diseases, natural disasters. The only thing left inside was hope, the one thing human beings could cling to, hold on to, and use to keep life going. And I think diabetes is like Pandora's box as well. Once someone has diabetes, there can be more than 100 different complications, from necrosis of fingers and toes, to foot problems, to sudden death from a heart attack, to partial paralysis from a stroke. And with diabetes, people often end up relying on hope alone. Ladies and gentlemen, at this point, some of you may say, why do good people still get diabetes? The question sounds a little funny, but yes, when you look at it, the number of people with diabetes is enormous. And up to 63% of people with diabetes have not yet been diagnosed. Those patients in hospital, those receiving treatment, those are only the visible tip of the iceberg. The undiagnosed group is far larger. And why does this happen? I believe the core issue is awareness of diabetes. Welcome back to my YouTube channel, and I am very happy to see you again. Today, the topic that I would like to share with you is titled, A Warning About Magnesium Deficiency. Ladies and gentlemen, when we talk about nutrition and health care, most people's very first thought is calcium supplementation. Children need calcium. As people grow older, the elderly need calcium because of osteoporosis. Pregnant women need calcium to nourish the baby in the womb. And the dairy industry as well as the dietary supplement industry have pushed calcium to a peak, even creating media noise. When many different companies claim that they have products with very high calcium content, and that calcium is extremely necessary for the human body. And it cannot be denied that in today's industrialized life, calcium is one of the nutrients that humans are most deficient in, very deficient. And it is also one of the most critically dangerous deficiencies. Ladies and gentlemen, I could describe calcium with one phrase: calcium is praise to the skies. However, behind the spotlight of calcium, people have forgotten something. They have forgotten another important element, and that is magnesium. According to a study from 1968 that I researched, magnesium was shown to participate in approximately 300 enzyme-catalyzed reactions in the human body. After that study, scientists later discovered that there are more than 300 enzyme-dependent reactions that rely on the assistance of magnesium. And the most recent data show that more than 600 enzyme-catalyzed reactions require magnesium as a cofactor, and more than 200 enzymes require magnesium for direct activation. These biochemical reactions include protein synthesis, gene repair, energy metabolism, regulation of blood sugar levels, regulation of blood pressure, muscle contraction and relaxation, as well as regulation of the nervous system and the immune system. It can be said that magnesium is an extremely important element in human life. However, in modern industrial society, due to the widespread use of synthetic fertilizers in modern agriculture, magnesium has gradually disappeared from the soil. As a result, the magnesium content in high-yield cereal grains has also decreased significantly. I believe that agricultural professionals understand this better than anyone else. In today's human diet, which mainly consists of processed foods and fast food, magnesium is lost in very large amounts. As a result, daily dietary intake can no longer meet the body's needs. Just like what I mentioned in the previous episode regarding calcium deficiency, relying on diet alone is not enough to supply the amount of calcium the body needs. And this time, as I promised you, I am returning to talk about another important element, which is magnesium. I have a story that I would like to tell. I have a female friend who is in the stage of rejuvenation, and every time she meets me, she shares that she often experiences palpitations, feelings of nervousness, and sudden facial flushing. And somewhat humorously, her husband becomes jealous when he sees his wife showing such symptoms. I believe that this is also one of the causes related to magnesium, and now I will explain it very clearly. This story may sound humorous, but I believe it is real. That is to say, many stories in life are truly real. I think that the topic of calcium deficiency attracts more attention because even people working in the medical field often believe that calcium is what matters most, and almost no one thinks that magnesium is important. In fact, as I mentioned before, the episode on calcium lasted only a little over 30 minutes. If calcium were discussed fully and thoroughly, it would take a very long time. Therefore, I deliberately reduced the dosage, so to speak, of the calcium episode in order to elevate the magnesium episode so that everyone can truly see how important magnesium is. As I have just said, magnesium participates in more than 600 reactions in the body, and this is a number that must be considered extremely significant, not to mention that the role of magnesium is, frankly speaking, enormous. So you can see that if calcium deficiency causes more than 100 different diseases in the human body, magnesium deficiency causes even more, to around 160 different diseases throughout the body. This reflects one thing: magnesium is extremely important, yet we pay no attention to it, and we do not even realize it exists. Here, I want to say that every day I see patients coming to medical examinations, and the majority of these patients show signs of calcium deficiency, magnesium deficiency, and of course vitamin D deficiency as well. Because without vitamin D, calcium and magnesium simply cannot be absorbed properly. Isn't that right? Therefore, right at the beginning of this program, I want to remind you and all of you that we must supplement a trio together, and that trio is calcium, magnesium, and vitamin D. This is something extremely important that you must never forget. If we only supplement calcium alone, that will not be sufficient. In a moment, I will go into each issue in detail, and we will clearly see how important this is. Returning to my friend's story, she frequently experiences palpitations, a racing heart, frequent facial flushing, and sometimes her heart rhythm becomes irregular. And then the husband becomes jealous and suspicious. I think this is a story that we might consider humorous, but in reality, it truly happens in everyday life. For most people, they tend to think that in life, every person has their own heartbeat, and sometimes we cannot control it with logic, because the heart seems to have its own reasons that we cannot control. However, in medicine, everything must be explained through very clear mechanisms: why arrhythmia occurs, why the heart beats fast at times and slow at other times. Here, we know that the heart has four chambers that contract to pump blood, right? And those four chambers must contract in a very synchronized manner. If that synchronization fails, if the ventricles contract, but the atria cannot coordinate, or the atria contract, but the ventricles do not respond, or the right side and left side fail to coordinate, then this will lead to heart rhythm disorders. These disorders result in palpitations, a pounding heartbeat, anxiety, and many other symptoms. So in order for the heart chambers to coordinate smoothly and contract properly, they require signals transmitted between them. These signals are called cardiac nerve signals, generated by structures such as the sinoatrial node, the atrioventricular node, and so on. Now the question is, what do these signals rely on in order to be transmitted? There are four elements involved in controlling heart rhythm contraction: sodium, which comes from our dietary salt; potassium, calcium, which we discussed in the previous episode, and magnesium. These four elements, sodium, potassium, calcium, and magnesium, are extremely important in cardiac nerve conduction. We can imagine cardiac nerve cells like this. Outside the cell is sodium, and inside the cell is potassium. When sodium moves from outside the cell into the cell, potassium must move out. This process of sodium entering and potassium exiting is exactly how nerve signals are transmitted. Secondly, The regulation of this nerve signal transmission is controlled by magnesium. Magnesium acts as the conductor, determining how much sodium enters and how much potassium exits. So we can imagine that if magnesium is deficient, sodium and potassium will no longer move in a coordinated and orderly way, no longer according to the proper plan. And when that happens, it leads to damage to the heart. Not to mention that calcium plays the role of muscle contraction, while magnesium plays the opposite role. It causes muscle relaxation. So we can see that magnesium is extremely important in the following aspects. First, it regulates the flow of sodium and potassium ions in nerve signal transmission. Second, it helps relax the heart muscle, while calcium causes the heart muscle to contract. Therefore, it becomes clear that if we lack calcium, heart rhythm is affected, and if we lack magnesium, heart rhythm is also affected. In fact, magnesium deficiency often causes more severe effects on heart rhythm than calcium deficiency. So here I want to say that when a patient shows symptoms of heart rhythm disorder with these kinds of manifestations, sometimes it is necessary to go to the hospital for evaluation, rather than to spouses staying at home, being jealous and suspicious of each other, wondering why the wife's heart is suddenly beating irregularly. That jealousy, I think, is unnecessary. What we really need to do is determine whether there is an actual medical problem, whether there is genuine cardiac damage. Through this story, I want to explain that magnesium plays an extremely important role in regulating heart rhythm, and many cases of arrhythmia are caused by magnesium deficiency, and sometimes all a doctor needs to do is prescribe regular magnesium supplementation, and the heart rhythm returns to normal. So if anyone encounters such a situation, they should understand it this way. And I also think of something else. Sometimes a very simple key can solve not only a health problem, but also misunderstandings within a family. Who knows, it might even preserve family happiness, right? At this point, I want to return to something I said earlier. Calcium and magnesium function like a couple. They cannot exist without each other. I once said that the human body contains about 75 trillion cells, and each cell can be compared to a living organism. These cells constantly metabolize and absorb various nutrients. Of course, cells do not have mouths to eat. For nutrients to enter the cell, there must be what we call carriers, and these carriers must be able to pass through the cell membrane. There are many substances that can cross cell membranes, including calcium and magnesium. I remember that calcium's membrane permeability is extremely high, up to 10,000 times, while magnesium's permeability is about 20 times. Carbonate is about 3 times, and potassium is about 70 times. Between calcium and magnesium, one is 10,000 times, and the other is 20 times. A huge difference. Somewhat unbalanced, isn't it? Well, in reality, it works like this. Magnesium and calcium are like a married couple. Magnesium plays the role of the wife, while calcium plays the role of the husband. Calcium is very prominent in the media. Everyone knows about it. On the market, calcium supplements are everywhere. Magnesium, on the other hand, is rare and largely unknown, and most people do not understand its role. Magnesium works quietly in the background. We already discussed calcium's role in the previous episode, but in this episode, we see that magnesium's role is even more important. Why is that? Because it directly participates in chemical reactions up to 600 reactions in the body. I consider this absolutely astonishing. And there are many other hidden functions of magnesium as well. Therefore, magnesium is like a wife who silently sacrifices behind the scenes. As we can see, calcium and magnesium have two opposing characteristics. For example, calcium causes muscle contraction, while magnesium causes muscle relaxation. Isn't that right? And especially when it comes to transporting substances into cells to nourish them, calcium transports nutrients and components into the cell. However, magnesium only enters the cell when it is needed. If it is not needed, magnesium does not enter the cell, it stays outside. But once calcium enters the cell, in order for it to exit properly, magnesium must signal it to come out. If magnesium is deficient and cannot signal calcium to exit, then calcium remains inside the cell. It stays there, and it exits very little, it does not exit sufficiently. This means that calcium and magnesium always function as a complementary pair. One is yin, one is yang. One balances and supplements the other. If calcium moves in one direction, magnesium moves in the opposite direction, so that the two tightly complement each other. So we can imagine this. If the body has enough calcium, then there are enough carriers to bring nutrients into the cell. But if there is nothing to signal those substances to leave the cell, then everything becomes meaningless, doesn't it? From that point, what happens? All symptoms of calcium deficiency also appear in magnesium deficiency, and vice versa. And there are some symptoms of magnesium deficiency that calcium deficiency does not have. Through this section, I want to say that the roles of magnesium and calcium are like a perfect duo. They always operate in a yin-yang relationship, always opposite, always accompanying each other, and always supporting one another. I have said that the four most common elements in the human body are sodium, potassium, calcium, and magnesium. The number one most important element is still considered to be calcium, and the second most important element is magnesium. However, if we shift our perspective slightly, I believe magnesium has many other hidden roles that we simply do not highlight or talk about enough. For now, we can temporarily accept that calcium is the most important husband and magnesium is the wife, and always remember that this couple can never be separated. If either one is missing, everything breaks down. So I ask you, you are taking calcium, are you also taking magnesium? And I believe that after hearing these warnings, many people will immediately go out and buy magnesium supplements. Let me share another real-life experience that many people encounter today. During the day, after working for a while, people start getting headaches, sometimes on the left side, sometimes on the right side, sometimes on both sides. On many days, vision becomes blurry. Pain radiates from the neck down to the arms, with aching and soreness on one side of the body, pain in the shoulder joints. Some people even find it difficult to hold a comb to brush their hair. Their body always feels as if all the energy has been drained. Climbing just a few steps makes them short of breath. Some people feel that their knee joints are unstable, their legs wobble, and they feel as if they are walking on borrowed strength. Their teeth feel sensitive when chewing. Even drinking plain water causes sensitivity. They often have inflamed gums. And the worst part is at night. After coming home in the evening, many people complain, "I'm completely exhausted." Their eyes droop, and all they want to do is sleep. But when they lie down in bed, although they are exhausted, they cannot fall asleep. Some people say they lie in bed counting sheep, but the more they count, the more awake they become. Thoughts about daily life keep looping in their mind, and they cannot break free, as if they are mentally electrocuted by work. They often feel aching pain along the bones, similar to symptoms of calcium deficiency. And frequently, around 3 a.m., they experience leg cramps. After that, they drift into a light sleep in the early morning, half awake and dreamy. The next day, they feel exhausted, work inefficiently, and their sleep remains fragmented. I believe this experience affects many office workers, especially those over the age of 35-40. Women tend to experience it more severely than men. Many people even think they are experiencing sleep paralysis. I will say the cause directly. It can be related to both calcium and magnesium, exactly like the pair I mentioned earlier. All of the symptoms I just described can appear in both calcium deficiency and magnesium deficiency. You will notice that many people only take calcium and not magnesium. When they take calcium alone, those symptoms improve significantly, but they do not disappear. They do not go away. Why is that? The first reason is that the dosage is insufficient. I can confidently say that even I personally take double the recommended dose of both magnesium and calcium. If I follow the label instructions exactly, it is not enough. I must take double the amount listed on the product instructions to meet my needs. So the first point I want to tell you is this: you are underdosing calcium. The second point is that you have forgotten magnesium. Forgetting magnesium leads to the problem I mentioned earlier. Calcium and magnesium must work as a pair. If you do not take both, symptoms only partially improve, and calcium cannot fully exert its effects because it needs magnesium. Meanwhile, magnesium deficiency alone can produce the same symptoms: migraines, daytime, drowsiness with nighttime, insomnia, startling awake, bone pain, swelling of the hands and feet, numbness, and tingling. All of these symptoms appear. Calcium sometimes only requires vitamin D for absorption. But magnesium requires not only vitamin D, it also requires sufficient calcium to be absorbed. And it requires another factor, estrogen. Estrogen is an ovarian hormone in women, and men have very low levels of it. Estrogen is extremely important for magnesium absorption. This explains why middle-aged women are more affected than men. As ovarian hormones decline, magnesium absorption decreases. That is why men are less affected than women. In addition, vitamin D plays a critical role. Vitamin D is both a vitamin and a hormone, and it is essential for magnesium absorption. Men are more likely to get sun exposure, while women often cover themselves, leading to vitamin D deficiency and impaired magnesium absorption. That is why I say there are many, many symptoms. The body has 8 major systems. If magnesium is deficient in any part, it affects the entire system just like calcium. For example, the eyes. Vision becomes blurry. People age 45 or 50 may notice that they can focus clearly on a nearby object, but when they look far away, everything becomes blurred. If they focus on distant objects, they cannot see near objects clearly. Why does this happen? Because magnesium deficiency weakens the eye's ability to adjust focus. The axial regulation of the eye becomes impaired. As a result, the eye struggles to adapt between near and far vision. This leads to blurred vision. Blood vessels are affected as well. This increases the risk of cataracts, retinal diseases, and rapid vision loss. This is just one example. All organs in the body can become diseased when magnesium is deficient. Whatever happens with calcium deficiency also happens with magnesium deficiency. Magnesium regulates other ions in the body, while calcium does not. Magnesium is also involved in cellular activity. There are 3,751 magnesium-binding proteins in the body. These proteins perform essential functions. When magnesium is deficient, these proteins cannot function properly, leading to widespread dysfunction and numerous symptoms. Magnesium is extremely important, yet it remains quiet and overlooked like the wife I described earlier. From the negative effects of deficiency to its role in improving many health conditions, magnesium plays a vast role. For example, magnesium can regulate emotions. In women during menstruation, magnesium can reduce menstrual cramps. So please be patient. We will examine each symptom and disease caused by magnesium deficiency. But first, I want to explain why magnesium deficiency causes fatigue and shortness of breath. In fact, this is how it works. As we know from the calcium episode, the human body contains about 75 trillion cells, and all of these cells require energy. For cells to have energy, substances must be transported into them, and the most important carrier for this process is calcium. Calcium brings substances and materials into the cell so that the cell can function, remain strong, alert, and comfortable. But if calcium cannot function properly either, because there is not enough of it or because its function is impaired, then the cell will lack materials, lack energy, and therefore become dysfunctional. As I explained earlier, calcium enters the cell up to 10,000 times. With such a high rate of entry, calcium must also be able to exit the cell. And for calcium to exit properly, magnesium is required. So if magnesium is deficient, calcium can no longer move in and out properly. This is one of the reasons why cells become deficient in energy. And when cells lack energy, the result is fatigue. The second reason is that magnesium binds to energy molecules known as ADP. ADP always exists in a form bound to magnesium. Magnesium carries this energy and transports it to cells. Now, if magnesium is deficient, energy cannot bind to magnesium. And if magnesium cannot deliver energy to every corner of the body will lack energy. For example, if the brain lacks magnesium or lacks calcium, as well, then the brain does not have sufficient energy. Brain cells lack the components required to function. When nerve cells and brain cells cannot function properly, we experience symptoms such as night blindness in the evening, extreme fatigue throughout the day, and inability to think clearly. Constant drowsiness without being able to sleep. When trying to think, we cannot think. When trying to solve a problem, we simply cannot. Students cannot solve their exercises. When trying to think deeply or plan carefully, we are unable to do so. Even muscles are affected. If muscles lack calcium for contraction and magnesium for relaxation, then muscles remain slack and exhausted. The body feels so tired that it barely wants to move. Even shooing a fly away feels like too much effort. Breathing also becomes shallow and insufficient. We constantly feel short of breath. We feel as though we are lacking oxygen. We may feel as though the air is polluted or the room is too cramped, and we simply cannot breathe comfortably. Sleep becomes disturbed. We wake suddenly. Even something as simple as snoring can be improved by supplementing calcium and magnesium. When we sleep at night, the muscles of the soft palate become slack. Without sufficient calcium and magnesium to stabilize them, airflow causes vibration, leading to snoring. Snoring reduces breathing efficiency. Poor breathing leads to rapid health deterioration and can be dangerous. Therefore, fatigue occurs because all 6 major systems of the body fall into a state of calcium and magnesium deficiency. The digestive system is affected. The respiratory system is affected. Every system is affected. For example, in the digestive system, many people believe that stomach ulcers and gastritis are caused by Helicobacter pylori, but the majority of the population is infected with H. pylori. Why do some people develop ulcers while others do not? I have seen patients whose stomach problems resolved simply by supplementing calcium and magnesium. Some patients with chronic acid reflux receive repeated treatments with various medications without improvement. But when calcium and magnesium are supplemented, the symptoms sometimes disappear. This applies to many other conditions as well. So I want to emphasize that from head to toe, if we lack these 2 micronutrients, the body will be severely affected. Numerous diseases emerge. Patients go from hospital to hospital without finding the cause, and treatment does not work. At this point, I have received many phone calls and messages from people who, after using calcium, magnesium, and vitamin D as I recommended, say it feels like a miracle cure. And I must emphasize, this is not medicine. Calcium and magnesium are not drugs. They are nutrients we consume daily. When our diet is insufficient, we supplement them. That is all. If we supplement correctly and sufficiently, the body remains healthy and capable. If we do not, we remain in a constant state of fatigue, as I described earlier. The body lacks energy from head to toe, not just in one part. 9. If magnesium is insufficient, we cannot maintain or restore normal sodium and potassium levels. This leads to overactivity of the nervous system. In real life, this manifests as sensitivity to nose, irritability, headaches, and irregular heart rhythms. Long-term magnesium deficiency can cause anxiety, panic, depression, muscle weakness, insomnia, loss of appetite, irritability, palpitations, and rapid pulse. As I have said, magnesium affects every organ system. That is why its deficiency presents with so many different symptoms. Here's a very important point. Magnesium controls the pump that moves sodium into the cell and potassium out of the cell. This pump determines whether cells can function properly. If magnesium is deficient, the pump fails. This leads to a cascade of consequences. For example, the adrenal glands. When affected, they increase adrenaline secretion. Excess adrenaline causes palpitations, emotional instability, stress, fatigue, and eventually psychological trauma. People become irritable, anxious, and unable to tolerate frustration. Excess adrenaline over time leads to high blood pressure. High blood pressure damages the cardiovascular system and mental health. Magnesium deficiency also causes metabolic disorders. Magnesium is essential for insulin secretion in the pancreas. Deficiency reduces insulin secretion, leading to diabetes. Magnesium participates in glucose metabolism, fat metabolism, and protein metabolism. When magnesium is lacking, metabolic reactions cannot complete properly. Instead of producing energy, carbon dioxide, and water, they produce intermediate metabolites. These intermediates cause fatigue and congestion in the body. When combined with lipid disorders and inflammation, blood vessel walls are damaged. This leads to atherosclerosis in the carotid arteries and cerebral vessels. Cognitive function declines. Calcium causes blood vessels to constrict, while magnesium causes them to relax. Without magnesium, blood vessels remain constricted, causing headaches and migraines. Blood flow becomes uneven between the left and right sides of the brain. If blood flow on one side is reduced, headaches occur on that side. This explains migraines. All these symptoms arise from magnesium deficiency. Mechanistically, magnesium participates in cellular reactions, regulates sodium-potassium pumps, and balances calcium activity. Whatever calcium does, magnesium counterbalances it to maintain equilibrium. Thus, magnesium deficiency leads to continuous neurological problems. These include insomnia, headaches, memory loss, attention deficit, epilepsy, thrombosis, atherosclerosis, heart attack, stroke, hypersensitivity to sound, inflammation, cataracts, blurred vision, respiratory dysfunction, and asthma. I want to emphasize, magnesium deficiency also causes dyslipidemia and diabetes. I will now explain this point more specifically. As I have already analyzed the mechanisms, magnesium participates in biochemical reactions throughout the body, regulates the sodium-potassium pump, participates in metabolic processes, and transports ATP, that is, energetic cells. When magnesium is deficient, these processes cannot proceed normally. When they cannot proceed normally, they cause many kinds of damage, not only the ones I have listed. There are many forms of damage. From head to toe, every part of the body can be affected when this deficiency occurs. So here I want to emphasize one important point. Let us imagine all the diseases that people go to hospitals for every day. I can say with certainty that about 75 to 80% of them are primarily due to calcium and magnesium deficiency. The remaining diseases account for only about 20 to 25%. Please remember this, so that instead of going from hospital to hospital, we know how to supplement appropriately. As for the length of this program, if I were to analyze each type of damage one by one as psychological issue as it would take a very long time. So I will explain it in a more concise way. For example, magnesium participates in a very important reaction, the conversion of tryptophan into serotonin. Serotonin is a very important neurotransmitter. Magnesium also participates in the metabolism of glutamate. Glutamate is the same substance found in monosodium glutamate, which we consume in food. In the body, glutamate is converted into GABA, which is also a neurotransmitter. If magnesium is deficient, these neurotransmitters are not produced adequately. When serotonin and GABA levels are reduced or severely deficient, people develop psychological disorders, emotional instability, and sleep disturbances. Sleep becomes poor. Sleep is restless. Falling asleep becomes difficult. At night, sleep becomes unbearable. We know that around 3 a.m. is when calcium and magnesium levels are lowest in the body. At that time, bone pain, aches, and discomfort appear, and sleep becomes impossible. Because these neurotransmitters are deficient, people lie there half awake, counting sheep, unable to fall asleep and unable to wake fully, feeling exhausted. This illustrates how complex the mechanisms are. Now, let me give another example. Let us talk about menstrual irregularities in women. Sometimes we immediately blame perimenopause, but that is not always the case. I've seen women whom I supplemented with magnesium and calcium, and even at 55 or 56 years old, they had not yet entered menopause. Of course, not entering menopause at that age may require medical evaluation. But what I want to emphasize is that many women aged 37, 38, or 40 already experience menopause or severe perimenopausal symptoms. They assume it is inevitable, but in reality, their bodies are deficient in magnesium and calcium. This deficiency leads to decreased ovarian hormones. When hormones such as estrogen and progesterone decline, abnormal uterine contractions occur. This causes menstrual pain. Menstrual flow becomes irregular, sometimes heavy, sometimes light. Cycles become unpredictable, but simply supplementing these two nutrients adequately can restore balance. Through these examples, I want to emphasize that time does not allow me to analyze every symptom: shortness of breath, arrhythmia, digestive disorders, urinary issues, reproductive problems each would take a long time. What is important is understanding the core principle I have explained. From that principle, everything else can be inferred. For doctors, we must understand these mechanisms thoroughly. Only then can we diagnose correctly and treat effectively. Now I will answer another common question. Why is magnesium deficiency related to constipation? This is a very interesting topic. As I mentioned before, constipation deserves a dedicated episode because it affects quality of life for so many people. Magnesium is involved in constipation for the following reasons. Calcium causes muscle contraction. Magnesium causes muscle relaxation. These two must work together. If someone has sufficient calcium but lacks magnesium, intestinal muscles contract but cannot relax. As a result, intestinal peristalsis becomes abnormal. In addition, when magnesium is deficient, intestinal cells function poorly. Poor cellular function reduces peristalsis and absorption, leading to constipation. Magnesium has a known effect of increasing intestinal motility. That is why older magnesium carbonate products often cause diarrhea. This increased motility helps prevent constipation. Another mechanism is that magnesium is not fully absorbed. Unabsorbed magnesium remains in the intestines. It increases osmotic pressure and draws water into the intestinal lumen. This softens stool and prevents constipation. Additionally, magnesium neutralizes certain acids in the gut that contribute to constipation. So magnesium plays an important role in preventing constipation. Some patients with chronic constipation are simply magnesium deficient. Many people repeatedly treat constipation with probiotics, enemas, and medications. But after supplementing adequate calcium and magnesium, bowel function often normalizes naturally. Now I want to address another topic that many people care about, cancer. While discussing magnesium, I reflected on an important point. Magnesium deficiency is also one of the causes of cancer. Why is this the case? As I explained in my cancer episode, cancer originates from genetic mutations. Magnesium plays a crucial role in DNA synthesis. Magnesium binds to nucleotides and transports them to the correct positions during DNA replication. DNA consists of two twisted nucleotide chains. For proper DNA synthesis, nucleotides A, T, G, and C must be placed precisely. If magnesium is deficient, each magnesium ion must perform too many tasks. This overload increases the risk of errors. If magnesium is sufficient, nucleotides are delivered correctly, reducing genetic mutations and cancer risk. Second, magnesium is involved in DNA repair. When genes are mutated, magnesium helps correct these errors by replacing incorrect nucleotides. Third, magnesium participates in protein synthesis. Many proteins are essential for preventing cancer. Defective protein synthesis due to magnesium deficiency increases cancer risk. Another critical role of magnesium is detoxification. Magnesium binds toxins and helps eliminate them through the liver and kidneys. Without magnesium, toxins accumulate, damage DNA, and cause cancer. Finally, magnesium is essential for immune function. The immune system acts like the police, identifying and destroying abnormal cells. Without magnesium, immune cells function poorly, allowing cancer cells to grow unchecked. For all these reasons, magnesium deficiency is a fundamental cause of tumors and cancer. Before moving on to how to supplement magnesium correctly, I want to clarify one more order of importance. Among calcium, potassium, sodium, and magnesium, if we look at overall abundance, magnesium is the fourth most abundant mineral in the human body, after calcium, potassium, and sodium. However, if we consider intracellular ions, magnesium deserves to rank second, even replacing potassium in importance. In an adult man weighing around 70 kilograms, there are approximately 25 grams of magnesium in the body. About 53% of this magnesium is distributed in the bones. Around 27% is found in muscles. About 19% is present in soft tissues, and roughly 1% is located in extracellular fluid and blood. Recent studies show that more than 300 enzyme reactions depend on magnesium, and as I mentioned earlier, the latest data indicate over 600 such reactions. These biochemical reactions include protein synthesis, DNA repair, energy metabolism, and regulation of the nervous and immune systems. Up to this point, we have talked extensively about how important magnesium is. Let me repeat it again. Magnesium is extremely important. But in terms of hierarchy, magnesium comes second only to calcium. It is the second in command, responsible for energy transmission inside cells and for regulating the body's demand for calcium. Calcium can only exit the cell when magnesium calls it out. That is why I chose to share the topic of magnesium deficiency with you. Long-term magnesium deficiency leads to a series of chronic diseases, from constipation, menstrual pain, and insomnia to heart disease, diabetes, and cancer, as I have analyzed. This raises a very important question. Why does magnesium deficiency occur so commonly in modern life, but not in the time of our ancestors? Let me explain. From ancient times through the pre-modern era, humans did not lack magnesium. Calcium deficiency was also rare, but the more modern our lifestyle becomes, the more magnesium deficiency increases. This paradox is alarming. The first major reason lies in our modern diet. To understand this, we need to see where magnesium is concentrated. For example, in grains such as rice, magnesium is concentrated in the bran layer, not in the white core. But we polish rice until it becomes white. In Western diets, magnesium is concentrated in the outer layer of wheat grains. That layer is removed during processing. Even traditional grains like barley, once soaked and milled, lose their magnesium-rich outer layers. Sugar is another example. Brown sugar made from sugarcane is extremely rich in magnesium, but we refine it into white sugar. The color of magnesium compounds is dark, yet we refine foods until they are white and pure. As a result, magnesium is removed. Salt is another critical example. Natural sea salt is extremely rich in magnesium. Unrefined sea salt, which appears dark and coarse, contains large amounts of magnesium. If a person consumes just 5 grams of unrefined sea salt per day, the amount recommended by the World Health Organization can obtain 100 to 150 milligrams of magnesium. That is a very significant amount. The recommended daily intake is around 420 milligrams for men and 320 milligrams for women. Yet almost no one eats unrefined sea salt. Everyone eats refined white salt or seasoning powders that contain almost no magnesium. We avoid natural sea salt because it tastes slightly bitter and looks dirty. We refine it until it becomes white, and in doing so, we remove all the magnesium. This means our diet is fundamentally magnesium deficient. And even when we try to eat magnesium-rich foods, we often prepare them incorrectly. For example, brown rice, beans, and legumes contain phytic acid. Phytic acid inhibits magnesium absorption. If we do not soak these foods properly for over 24 hours in warm water, phytic acid remains, and magnesium cannot be absorbed. Most people do not know how to remove phytic acid. As a result, even magnesium-rich foods become ineffective. This is the first reason modern diets cause magnesium deficiency. The second reason is what I call the curse of modern agriculture. Modern agriculture prioritizes yield. Magnesium in soil cannot regenerate on its own. Continuous farming depletes soil magnesium. Studies from 1950 to 1991 show that magnesium content in vegetables worldwide decreased by 25 to 75%. After 1991, this trend continued. Modern aquaculture also contributes. Most seafood today is farm, not wild-caught. Farmed seafood lacks the high magnesium content of ocean environments. Thus, modern food sources contain far less magnesium. Another major factor is environmental toxicity. We are constantly exposed to toxins through food, air, water, and pollution. Magnesium is essential for detoxification. It binds toxins and transports them to the liver and kidneys for elimination. As toxin exposure increases, magnesium is consumed more rapidly. Medication overuse is another major factor. Most drugs contain toxic components. Even supplements have toxic fractions. Excessive drug use depletes magnesium because magnesium is required for detoxification. As a result, modern society experiences widespread magnesium deficiency. Even with a good diet, most people obtain only about half the magnesium they need. This is my warning to everyone. We must change our lifestyle and supplement magnesium properly. We must learn how to eat correctly. When traveling to coastal regions, buy natural sea salt and use it throughout the year. We support salt farmers and replenish magnesium at the same time. Why insist on refined white salt? Our modern lifestyle places us in a constant state of micronutrient deficiency, especially magnesium deficiency. No matter how well we eat, we cannot meet magnesium needs without supplementation. Now, let us talk about children. Do children need magnesium supplements? Infants absorb about 75% of dietary magnesium. Adolescents absorb around 40%. This high absorption rate means most children do not suffer from magnesium deficiency. That is why magnesium supplements for children are rare. Most products are recommended only for adults. Of course, some children are deficient. I have seen children brought in for evaluation due to poor academic performance. Some were even sent for brain imaging. After evaluating their diet, I found magnesium deficiency. Once supplemented, their memory and learning improved. But these cases are rare. Most children do not require supplementation. The group that needs magnesium supplementation most is adults. Now let me address another common question. Why does calcium cause constipation, while magnesium sometimes causes diarrhea? The answer lies in how we take them. Older magnesium products, such as magnesium carbonate, were more likely to cause diarrhea. Today, magnesium exists in many forms. I cannot recommend specific brands publicly, as that would constitute advertising. But I promise to return to this topic and analyze different forms of calcium and magnesium in future discussions. Incorrect product choice and incorrect dosing cause side effects. The key principle is dose division. For example, when taking 40 milligrams of magnesium at one time, absorption is about 65%. When taking 550 milligrams at once, absorption drops to 30%. Smaller doses lead to better absorption and fewer gastrointestinal side effects. Another important principle is timing and separation. Calcium and magnesium compete for absorption. If calcium intake is much higher, magnesium absorption decreases, and vice versa. The optimal ratio is about 2:1 calcium to magnesium. Even so, most doctors recommend taking them separately, at least 2 hours apart. I personally do not recommend combined mixed products. Separate supplementation allows better absorption and fewer side effects. Another critical point is timing. Most products recommend morning dosing. This is incorrect. Around 3 a.m., calcium and magnesium levels are lowest. Supplementing before bedtime improves sleep and prevents bone mineral loss. Personally, I take calcium in the morning and evening, magnesium at midday and before bed. Others may reverse this, but at least one dose should be taken before sleep. With proper product choice, correct dosing, and proper timing, constipation and diarrhea can be avoided. Many viewers ask me to recommend a specific brand. I always refuse. Affordable products are sufficient if taken correctly. Even basic calcium carbonate and magnesium carbonate can be effective if used properly. These require stomach acid to dissolve. Good times to take them include 9 a.m., 9 p.m., or 30 minutes after meals. They can also be taken on an empty stomach with a small amount of water. Understanding the mechanism is essential. There are no shortcuts to health. Knowledge must be built carefully. Each person must become their own doctor before seeking medical care. Thank you very much for watching until the end. Take care of your hair while you still have hair. Brush your teeth while you still have teeth. And take care of your health while you are still healthy. Thank you again for listening.